You may all be seated. I would like to welcome everyone to the first official sitting for the City of Johannesburg Men's Parliament under the theme Deepening Accountability Amongst Men and Boys to Respond Decisively to South African Socio-Economic Challenges. I'm sure everyone has an agenda sitting in front of them. If you don't, please raise your hand and you'll be assisted. Please assist all our colleagues who don't have the agendas. We are done with our national anthem, and before I start with the opening remarks from the Chief of Staff, I would like to go through the acknowledgements. I'm going to read all the acknowledgements, and at the end, we can clap for them. I'll start with acknowledging Mr. Arnold Sibanda. Mr. Arnold is from the Black Men Positivity Project, followed by Honorable King Mashia II from the Royal House. We also have Mr. Peter Malajana and Mr. Philip Makwela from the Greater Diepsloot Business Forum. Among our midst, we also have Father Xolani Dlwati from the Moral Regeneration Movement. We also have Dineo Meko, and Dineo Meko is from the Puso Development Group. We have representative from Johannesburg Health District among our midst. We have the Acting Executive Director of Health, Mr. Peter Mangaye. In our midst, we also have directors from the Health Department. We also have Regional Deputy Directors of Health. We have our colleagues from AA2 Digital School Solution, Mr. Aubrey Masugu. We have Gauteng Provincial Legislature, and the names are Thulaganyo Khumalo, Benjamin Muleme, Soli Mhlala, Dumisane Ntungwa, Nelisiwe Mabuza. And the last name on the acknowledgement list is Mr. Maponyane from the JRA. We also have representation from the MMC's Office of Health and Social Development, MMC Makafula. Colleagues, you are all welcome. Can we give them a round of applause? When we look at our agenda, we're supposed to have Councillor Sihle Nguze in the welcome remarks, but Councillor Nguze has a current situation in his ward that he's handling. I would like to call the Chief of Staff from the Office of the Speaker to do the welcome remarks.
Thank you, Madam Speaker, the co-chair of the program, Councillor Nobuhle Mthembu, Mr. Charles Mpepu, the co-chair of the program today, who's the City of Johannesburg Men's Sector Chairperson, and all the acknowledged delegates that have been acknowledged by the Speaker, and as well all the delegates that are here today. We would like to welcome you. Councillors are a responsibility of the Speaker. So as I stand on here in the space of Councillor Nguze, the Speaker is the person responsible for councillors. So as the Chief of Staff in the Office of the Speaker, I would like to take this opportunity to welcome you all, and we appreciate your presence. It is quite exciting to see your attendance here. as men in our society, in this great city of Johannesburg, where we require all hands on deck. So as we have you in this first sitting, it's a milestone that when we look back, you'll always remember this day, that you were here with us to deliberate and take charge of the future of this city. So we really appreciate you, and we hopefully that as you engage, and after the engagements, all the outcomes that will come out of these engagements, you'll take it up with yourselves as you go out to do what is necessary, so that we build a society that is quite strong. We build a society that when we all look back at, we appreciate and we honor, because we all know that as we look in our society, we do want men to come back in society and to take their rightful space and lead, so that we all work together. So with those few words, I really welcome you all, and I look forward to your discussions, and hopefully we'll then, when we have the next session, we'll all be together, and even those that are not here today might want to be part and not miss this session. So thank you so much. You are truly welcome. Thank you. Thank you, Madam Speaker.
Siyabonga, Mr. Chief of Staff. Mr. Ruben Masango. I'm going to call my co-chair for the day, Mr. Charles Mpepu. Mr. Charles Mpepu is the chairperson of the City of Johannesburg Men's Sector, and he'll be doing our opening remarks.
Lento siyenzayo, lento siyenzayo, valo tololo, valo tololo, valo tololo. Lento siyenzayo, lento siyenzayo, lento siyenzayo, valo valo tololo, valo valo tololo. Thank you very much, Speaker, for this opportunity. Let me start by greeting the official from the City of Johannesburg, honorable kings who are within us here, the Izinduna from the City of Johannesburg, and all the officials and MMCs, the chairs of chairs, and then office of the MMC also are here, and then the secretariat. It's been hard to, and also the planning team, because to be here today is because there are people who are planning behind this event today. So we would like to acknowledge all of you for your hard work, and then from the office of the Speaker also, we thank to allow us to be here today, because getting here, you get an election. So men are coming here, sitting on the other people who have voted for. It's a privilege. Thank you very much, Speaker. And then I would like to say to all of you today, following the launch of the Men's Parliament on the 18th November 2024, here at the Konibupela Council Chamber, a lot of activities and outreach awareness campaigns has been done in the sub-district, working in collaboration with the multi-sector coordinators in the community. The subsequent sitting scheduled for today at this council chamber, and all of you we are making a history for the first sitting of Men's Parliament at the city of Johannesburg. It is a program that focuses on prevention of gender-based violence, femicide, GBVF, and sexual gender-based violence, and HIV and TB, and also to promote the medical male circumcision and extensively engagement with boys and men in the community to change their social behavior. The vision here is to institutionalize the responsive men's movement, and the mission is to call to action for men by men to stand up and counted as relevant in building a men's society movement that is robust, accountable, and follow the rules of law. In terms of the background, HIV and AIDS and gender-based violence have been described as a dual epidemic and plague all the developing countries, and the city of Johannesburg has one of the highest level in terms of gender-based violence and HIV infection in this province of Gauteng, where in Gauteng, the total of 326,346 people who are living with HIV were disengaged from care. They know their status, but they're disengaged. They're not taking their treatment. And it's a shocking number. Majority of that number are men. So, and in COJ, where we are today, we have 141,215 who are not on treatment. What's more, you are welcome on this first sitting of the Men's Parliament. Acknowledge the challenges that require all of us to put our head on the deck, and require us to work together and focus on those who are not on treatment to bring them back to care. New infection is high, with young people between the age of 15 and 24 are vulnerable and are on the risk of infecting this virus. So the Minister of Health, Dr. Aaron Motsoaledi, on the 25 February 2025, launched the 1.1 million ART program to close the gap. On those number of 1.1 million people who are missing on treatment in the whole country. But where we're sitting today on the city of Johannesburg, in this district, 141,000 reside here in the city of Johannesburg. And those is not just estates, it's our brothers and sisters and our neighbors. We go back to your regions. When you go back to your regions, let's make sure that you encourage every man from every ward to have representative to talk about these issues on our corner. And also, we are also on the process of establishing the sub-district men's parliament from all those 7 regions. When you go back, make sure that every ward in your regions has a representative, have a man, and we urge the political leaders to willing to support, because even political parties, they have men who are their members. And when we talk about numbers, we don't know. Maybe some of us are here, which we counted them in, and some are members of those political parties. And we use those councillors to set on all those wards to support this men's initiative, so that we can able to bring all those 141,000 back to care by the end of December this year. And we are going to come back here on October, because we're supposed to sit on April and October, 2 sitting in this district. When we come back on October, we'd like from different regions, from different wards, to tell us, what did you do when you heard about these numbers? When you go back, when you play dice, when you play soccer, have a legal talk about these people who are missing on treatment. When you're at the sports, we need to talk. Amakosi, when you call community, talk about this. Izinduna, when you call people where you stay, talk about this issue, so that if all of us, we work together, we can able to address this and make sure that our young people are not on the risk of infection about HIV. And then also, I stand before you to make the call to action, to stand up and save lives, and fully committed to align our activities with the national NSP goal to make sure that by 2030, we have a zero-free HIV generation. I declare this meeting officially opened.
Thank you, Chairperson, Mr. Charles Mpepu. We'll move over to the City of Johannesburg Men's Sector Security Report, and it will be presented by Mr. Sibusiso Sitole, the Secretary of the City of Johannesburg Men's Sector.
Madoda. Ndoda. Good morning, leaders. I think I'm a bit, I need assistance to connect.
IT, can you assist? Mr. Sitole, they'll assist you shortly.
Okay, thank you, Chair. I think I would like to also take this time, Chair, to welcome everyone and say thank you for being here and thank you for allowing us to be here. I've been looking forward to this day for one simple reason, because there's a young man from Soweto I met that I need to report Women's Parliament. I actually raised it and I said I will actually speak about him. So there's a concern around this. So during one of our interventions in Soweto, this young man, a room full of people, he raises his hand with a smile on his face and he says, I have a very serious question. My question is, what is a man? And I looked at the co-facilitator and he looks at me and we smile because we know this is about to go down. So we throw it to the community. We say, let's have an open discussion around. It's a simple question, but when you listen to it properly, it's very deep. So the man in the room and the woman hoy answers. They all hoy answers. Others are saying your biological makeup makes you the man that you are. And the others are saying, hi, Bo, that's not it. Culture, tradition, religion makes you a man, right? And I can see some of you are looking at me and you are also thinking the same thing, but isn't it that what makes a man? So this young man said, raises his hand again, he says, with all due respect, and you know, if you work in the space, when someone says to you, with all due respect, you know what's coming. So this young man says, with all due respect, I would like to say my piece and I need to be protected. I don't need all the things that makes a man. I just need to know what is a man. And I had a smile on my face because I knew where this was going. But also judging by the faces that I see in front of me, you are also concerned, you are wondering, what is a man? Without putting all the things that are making up this man. Without talking religion, without talking tradition and culture, at the end of the day, with all due respect, can I start my presentation? Whilst you think about it, I will come back to it. So I hope this young man is watching, because I did say I will report him here. Igama Usbusiso Wagastole, I'm the secretary in the district. I think these are some of the things that we are facing in Good Community when we are working with young people. At the end of the day, we want young men that can be able to talk. We want young men that can be able to shape the communities that we live in. So I like that young man, even though I'm reporting him, but I like him. I think in this report, we are going to provide a comprehensive overview of the activities that were undertaken by the men's sector and the parliament within the city of Johannesburg for this reporting time. It highlights key activities in community engagements around health awareness, youth development, and whilst also addressing challenges that are encountered and outlining strategic preparations for expanding our reach through the ward-based and sub-district parliaments. The men's sector continues its vital work in terms of supporting the men with interventions and activities to make sure that we shape up the young men and the older men that we want in our society. Because, I mean, it's pointless to talk and not leave the action. So it's also important to hold men accountable so that we are what we are talking about. And I think we also advocate for men to be agents of change. Hence, it's very important to hold each other accountable, to not only be the ones that are talking, but in private, we do the opposite. So in this report, you'll also know about the key programs that we do. And one of the programs that we do as the sector is the Adolescent Boys and Young Men program, which is the same program where I met this young man that gave me this brave, bold question. This program was designed because we felt all the programs are speaking women and children, and there's nothing for men. But also when we had something for men, we then decided, we can't just do talk to men and leave the young men outside. Because even the campaigns that go to school would definitely give the young girl ama dignity packs and give the young men nothing. When in actual fact, the only thing that the young men will not be able to use in that dignity pack is the sanitary pad. But everything else, the young men needs all those things. So we have this program that also, the objective of this program is to make sure that we also give them essential life skills, and we promote positive masculinity. We address the risk factors such as early sexual debut, because I think the other thing that has been failing us is the fact that we give the young girls all the empowerment, we give the young girls and the young women all the support that they need. And we are forgetting that these young women will eventually date at some point, and the person they will be dating is the same person who was in high school with them, standing there in the corner and not receiving any support, not receiving any information around GPV, not receiving anything around treatment. And this young man will be shocked to see that this young woman is so empowered and she can stand up for herself. And as a young man, this young man was brought up in a society that does not give him the skills that he needs to be able to deal with an empowered woman. So it will be a problem. And we thought with this program, we will reach out to as many young people in different areas to try and address the same issues. With these initiatives, we are also working with organizations like Mentor a Boy Child, because again, there's programs that are taking a girl child to work, but there's no programs that are taking a boy child to work. Don't look at me like that. I don't know why. But this is something we need to also change to make sure that we also take the young men and the young boys to work so that they can see. And the future is that we also want to expand this program and take it to greater heights and reach as many young men as we possibly can. Because the young men that we reach are the same young men to report, because we want them empowered, we want them to be able to raise issues. And the next program that we have, we call it Check Impilo campaign, where again, as men, to address the issues, the masculinity and the behaviors that are saying to young men, as a young man, you must not feel pain. Tigers don't cry, isn't it? So, and as a tiger, even when you are sick to such an extent that you can't get out of bed, you still don't want to be taken to the hospital. You know why? Because we indoda. As a man, it shows that you are strong all the way, even till the day you die. Because society has brought us up to believe that we are untouchable, we are strong. And we want to do away with that notion to say men are also human beings. Men also need to be looked at with an eye that says we are also scared. If there's a noise outside in your house and you feel like screaming, and you feel like screaming, you are allowed to scream, Brafil, ne? Because I get it, as a man, we are saying if you hear noises outside in your house, you shouldn't scream. Why are you laughing? So because of our society, we are saying men should not be scared. But in actual fact, men are also scared. If there's a man in this room that does not lock a gate, that does not lock a door, that does not worry about protection, may they please raise their hand. My point exactly. So men, before everything else, and this is the answer I gave the young men. I said to the young men, as a man, you are a human being before you become a man. I'm not sure if it makes sense. It does. Okay. So he looked at me with a look that says, Mara. I said, the things that makes the man are the things that shape him as he goes. But yeah, in totality, as a human being, if you put him there and you raise him and you don't give him all these toxic masculinity messages, he will still be a man that would be saying, ouch, it's painful. He would still be a man that says, baby, I'm scared. Marage, I'll go and check it. You know? He will still be a man that says, I'm willing to protect my family. But at the same time, he will be a man that's empowered enough to say, I'm unemployed and I can't provide for now. Can you please assist me for these 3 months, for an example? You know, we need men to actually acknowledge the fact that we have challenges that we can't talk about. We have a society that has created us to become what we are, and because of that, the numbers, the suicides are very high around men, because men are under pressure, men are struggling, men need safe spaces where they can go and talk about issues. And with this Check Impilo program, we are actually saying to men, come, have a safe space, deliberate, talk about these issues, and be in a safe environment with men that can also understand you and support you. So through this activity, we also discuss things like your STI screening. I'm not sure if I must say this, I think, but it's important for STI messaging. STIs, you know, when you have funny things around your genitalia, and because other men are not empowered and informed, they still continue to use that same equipment with all the stuff on it because of the messages that we give them to say you are strong, so you must lead by example. So that is also some of the things that we pick up in the communities as we do the work that we do. We want to change that narrative. We want to empower men, and we want to see a generation that will make decisions. The other one is the community dialogues, where we call meetings and we sit with men, we empower them, we find out what they think, and then why they do the things that they do, and we try and change that narrative to say, but you can't do it like this, you can do it like that. It's also okay to talk about topics that includes mental health, topic that talks about fatherhood. Some of the men are wounded as we walk. We have wounds because our fathers neglected us, and we also take it out on our kids. So these are some of the things that we discuss in our community dialogues. And when we hold the community dialogues, we are not alone. We are not the only ones doing it. We do it with the support from other sectors. We do it with the support from the kings, the queens. We do it with the support from the chiefs. We do it with the support from the city. We do it with the support from... So we need all the stakeholders to make sure that we drive the messaging to men that's proper and accurate. And we also have a program where we call the Ndota Wednesdays, where it's very important to, as men, also have a day where we can discuss issues. So we have this day, the Ndota Wednesday, where men can sit and talk about issues that are around fatherhood, around families, around, it could even be issues around unemployment. So the Ndota Wednesday is a program that kick-started with the men's sector, and it's doing very well in Region E. They've already implemented it and discussed a job readiness and workshop. There's also implementation that we are planning to roll out to all the rest of the other regions in the city. Our challenges, I think, have been around the fact that the resources are constrained. We can't be everywhere all the time. I saw some of the leaders that have invited us to events and we couldn't make it because of the constraints, and also that we have limited human resources as well to get around to every place. But we are willing, we just need the resources to make the work possible. We also have a challenge in terms of sustaining and engaging men. We know that men most of the time need to go biopanda, so they can't be in one place all the time. So if you call men to a workshop or to a Mbizo, the first thing they ask is, what will I get when I get there? If you ask them to test, they say, what will I get after I test for HIV, you know? So men also need to be pushed and encouraged without incentives. And it's also a challenge for us as the men's sector to reach them. And we also have a challenge with shifting perceptions that with the societal norms and about masculinity and the long-term challenges that requires sustained advocacy and education. But our most challenging area is Region B. Region B, finding an organization that's servicing men has also been a very challenge in Region B because we don't have structured organizations that are working on the men's movement in the area. There's no support that's coming from other areas to support, to make sure that we build and capacitate small organizations and make sure that they are able to deliver the work that we want them to do. And in conclusion, and I would also like to recommend the fact that it's commendable for Region E what they are doing with the Ndota Wednesday. I think we need to take lessons from there and implement them in all the other regions. That would be very important, and it will change lives. However, the challenges in Region B, we also need tailored interventions and intensive efforts to build a local capacity. As we are planning to do a strategic role, the district parliaments and the sub-district parliaments, we need to be ready for all of that in Region B as we are capacitating them. Also, the recommendation is to prioritize Region B and allocated dedicated resources and personnel to facilitate the establishment of men's focused organizations in the region, and also to standardize the Wednesdays in all the regions with a comprehensive toolkit and provide ongoing support to all regions for the consistent and impactful implementation of the Wednesdays. Capacity building, we need also to invest in continuous training and development for all men's parliament volunteers, coordinators, particularly at the grassroots level. And we also need to strengthen partnerships, actively seeking and formalizing partnerships with civil society organizations, faith-based organizations, traditional healers and academic institutions, to amplify our efforts. And we also need to do monitoring and evaluation of the activities as we go. We extend our sincere gratitude to all the stakeholders, the volunteers and community members who are contributing to the work that we do as the men's sector. We are aware that there's so many men's movements that are doing so much work in the communities that are not really recognized. So we would also like to take that time to say we recognize you, we see you, and reach out. We are ready, we are available, we are ready to work with you. And together we can build a society where men are actively engaged as positive agents of change, contributing to a safer and healthier and more equitable communities. Let us stand up together. Madoda. Madoda. I thank you.
Siyabonga, Secretary, Mr. Sibusiso Sithole. Colleagues, we'll move over to the Johannesburg Health District Men's Program Overview, and it will be presented by Mr. Mudihwana Mufokeng. Mr. Mudihwana Mufokeng, please come to the platform.
Just a second. Madoda. Doda. Munna. Banna. Thank you very much, and good morning to Madam Speaker and all men in this building. I just want to go on a slide, sure. Okay. Yeah. I think I need to say it's an honor for me to be in this building to share, the ideas with other men, especially all our men's sector, our civil society that are operational on the ground. Your work efforts are not going unnoticed, and it's because of you as Johannesburg Health District that we are also surviving. So, my name is Madingwana Moses Mufokeng, Madingwana. That's my name, and Mufokeng is my surname. So I'm the VMMC Program Manager for Johannesburg Health District. So I will just be presenting an overview performance as well as the challenges that we have in Johannesburg in terms of men's health, but specifically focusing on the VMMC, voluntary medical male circumcision. As you know, my daughter, all the time, Dr. Hana Hamatume is the one who will always be presenting these issues. However, because of certain activities and bereavement in the family, he couldn't make it to this end. So, firstly, I just wanted to show you, this is our clinics, actually facilities that we cater for our men in the district. Specifically, this is for VMMC, from Region A until Region G, we are having a men's clinic. If you look to your extreme right, those are the RT35 private facilities, meaning that those are the doctors we have contracted to service our communities or our men in terms of VMMC. Those are their facilities, and in the middle you will see those are our own Department of Health facilities, because we are trying to maintain sustainability if the doctors are no longer present, so we can continue servicing our facilities, our men. So the main focus, if you remember with VMMC, it's not only about uksika fela, harisehi fela, but it's a package. We're looking at issues of TB screening, linkage to care, and referrals of other conditions. Let me say you go to a facility, your main aim was to go there to get circumcised as a man or a boy, but normally they will do testing in terms of testing for HIV, they will check your sugar levels, they will check your BP. Actually, the medical component of it should be tested before you can even go to that bed and get circumcised. So in terms of VMMC, that's a package that we are actually doing. And we also need to do the follow-ups after we did the surgery. So, my daughter, I think on this one, I wanted to put this as a wake-up call for all of us men in this building to say, this is our performance for financial year 2024-2025 in terms of VMMC. Remember, like I explained now, that VMMC is an entry level of a man to be diagnosed either if he's positive or negative. And that's the entry level where a man can access treatment for HIV or TB. So this is our performance in terms of the districts. On your left, that's the targets that we are given by the Department of Health, and then that's the actual performance. So unfortunately, I think I'm really bright there, because in most of the regions, from region A up to G, we did not do well for 2024, 2025. I'm just brief about it because of time. And in general, we are almost at 72% for the financial year 2024, 2025, meaning that we didn't access more men in our district. So it's a wake-up call that this financial year, we need to work very hard for that. So this is the same, it's talking to the same thing, that this is a percentage. If you look sub-district A, you'll see they are at 70%. In quarter 4, 81% in B, and then 65% in C, 51%. The district that is actually performing well, it was region F. And look at, no, not F, it's E. So look at F, it's actually at 14%. So really, this is really not, it doesn't indicate that we are accessing men in our district. We need that gap that Mr. Zbusis was talking about, 141 men that we need to diagnose, also to contribute towards the 1.1 million, which was launched by our MEC. So on this one, I wanted to take you so that we understand and we sell this idea that it's not about circumcisions, it's about men's health. When you go to that clinic as a man, you will be checked TB, you'll be checked STI, you'll be checked hypertension, diabetes, and then also for other conditions. And this is just I was just taking an example of what it's done to a man when he visits those facilities for VMMC. So it's a great opportunity for men because, you know, when you are with other men and all this is done to you, then you will feel very much comfortable. So there is a concerning issue around men. This, I took it as an example from one of our implementing partners. If you look there, they did 173 circumcisions. But if I can tell you, 15 were diagnosed positive, and then 14 declined. So you see now, if in our mindset, when we go to a facility, we still don't want to test for HIV, it's a problem. If we manage to diagnose, out of 173, we managed to diagnose 15 people and put them on treatment, it's an achievement. But a failure is that the 14 that decline. Why as men, like Nakele Monna, why do I refuse to get a free service of testing, and then I will be referred, and then I will be started on treatment, and I become healthy, I prolong my life? Why do I do this? So those are the issues that we need to also focus on. So on this slide, I wanted to say, yes, yeah, there are challenges, but there are achievements that we have that we achieved. In terms of monthly, the last month of, if you look at the quota, but it was only one sub-district that achieved. So we have achieved the TMI implementation. I'm happy that even in the House we've got traditional leaders. So in Johannesburg, last financial year, we're having like 30,000, 30 approved TMI, meaning the Komatako Tabe in sub-district G. We had 30 because they were vetted. We looked how appropriate, how valid they are, and we include our traditional healers on that one. Dabezita was leading the program in terms of ensuring that where our kids or our boys are going, it's a valid traditional setting. So it was led by Right to Care Chaps together with Johannesburg Health District. We actually, when they are about to go to the mountain, we do the vital signs, we check their BP. If you are, your child or the boy is having asthma or hypertension, whatever, so that he's being taken care of when he's in the mountain. So in those 30 schools, we managed to do 1,800 circumcisions, no death, no severe AEs, no referral to hospitals, because Dr. Denisa from sub-district G was handling the whole thing, as well as our traditional healers. So it was a big achievement, because you find you send a boy to the mountain, he doesn't come back. So we want to avoid that as Johannesburg. So I think the other achievement, I was with Bra Ike and Dr. Matume Khanaga, and we invited all the RT35 doctors, the one that I showed the private facilities. Madota, they are willing to partnership with all the civil societies, men's sector, to promote that Men's Wednesday that we have been talking about all along. To say on Wednesday, in sub-district G, we are having this facility from this doctor, we can sit down. We are not going to talk about only health. We talk about the social skills that are happening, how can we approach it? So that one will still go into lies with the leaders of all men's sector. And that is one of the achievements. On this one, Madod, I wanted to show you how difficult, if we are men, we go to the clinic, we test, but we don't avail ourselves for the treatment. It's a bit of an issue. Look there, this is region F. We tested 9 who were positive. I just take this light for the 2 clients were contacted telephonically, but it was ringing, no answer. The 3 clients contacted telephonically, it went to voicemail. Even though we check, we have what we call lab track. If maybe you are already on a treatment for HIV, we are able to see if we put your ID or your names, we can see that, no, this one is on treatment. So we normally contact them. If we don't see them, we look if this person is not on treatment. So only one client was found to be known positive since 2019 and a treatment interrupted since 2022. Meaning that this man who knows that he's HIV positive, but at some point he left to take treatment. So you will just imagine what is happening there. One client successfully linked to care at Linaze South, and then one client successfully linked to care in Southern Hospital. So I just wanted to give you a picture that we need to radically change the mindset of a man to say, it's not a death sentence, we just need to prolong our life. So this is the challenge, only one challenge, linkage. We need to convince men to start the treatment. We need to convince men to come on Wednesday to discuss their social ills in terms of health, in terms of everything, so that we are not angered. When you go to a clinic, you see mother and child is there. You see acute, you see what, but you will never see men's health. So as the district, we are working so hard to say, you know, facilitating this with the RT35 to say men must be able to go on a Wednesday. You go somewhere, you sit there, you discuss your own issues and how you want to develop your community immediately in your own little room. So on that note, I'm going to my last slide, and I would like to thank everyone and the Madam Speaker. Thank you very much.
Thank you, Mr. Mufokeng. Colleagues, I would like to hand over to my co-chairperson, Mr. Charles Mpepu, to take over in the next facilitation.
Thank you, the Speaker, for this opportunity. Doda. Yeah, singalali madoda. There's one Hosi Hadi Wabatokwa, who's within us here. We acknowledge you to be within us. And then I'm moving on the program. We're going to call the messages of support. I'm going to give 2 minutes, and we are at the chamber here. The time count very much. And then we're going to call ONS Manamela from HRM, and then we call, followed by Reference Tami, and followed by Uzi Zipo from Father Nation, and then followed by the traditional leaders, one representative to give the message of support, and then we'll call others when those are done with their 2 minutes. Can we do that? Give them the hand of applause when they're coming to the podium.
Madota. Ndoda.
Doda.
I'm not convinced. Madota.
Doda.
Good morning, ladies and gentlemen. I would like to greet the Madam Speaker, the Office of the Mayor, the Chairperson, the Secretary, the esteemed members of the Cabinet, all the councillors that are here, the traditional leaders, all the distinguished guests from all walks of life. It's an honor for me to be here with you today. I'm actually given 2 minutes by my chairperson, Dr. Charles Mpepu. My role today is just to give message of support. To say, as men, we've seen the stats from Dr. Mufokeng, my leader on my side. We can see that as men, we cannot be silent. Our brothers are dying. Some of us, we don't even know our status as we are sitting here. And I tell you, we are doing more harm than good at the moment. So as a member of HRM, I'm just here to say, man, let's treat ourselves as brands. As a brand, you don't want to go to people and present a sickly brand. Let's take pride in our well-being, in our health. And I think more than anything, I've heard all the speakers, I've seen the presentations, but I want to think that as men, some of the issues, the fundamental issues that affect us are of three things. I think our health is a great deal. You don't, if a man is sick, is broken, he does a damage to society. We know what we do. I know what I used to do when I was driving Evropa. And we know that sometimes when you've got some sort of a power, some people will not even ask you for protection. We know that. I must apologize to the ladies that are here that I try to bring it as raw as it is so we can really bring about the difference. I think the issue of health is of critical importance. The issue of economy, that they touched it, to say, I think we are at the right place, and I'm happy that our leaders are here to say it's high time that the government and the political parties and the rulers of this country start thinking of us as well. Because everything else is ladies this, girl child this, but what about the boy child? I mean, our girls are getting so empowered such that even our boys are starting to become scared of them. I know as we are seated here, there are some ladies that we can never even approach because you just look at it and say, my God, what will I say? This woman seems like she's got everything intact. What am I going to add? And the ladies, they tell you, they say, what will you bring to my life? I mean, it's the truth. So as men, let's get together as men. Let's empower ourselves. The rulers of this country, the government, give us opportunities, give us the financing. Some of us are running businesses, but not even the bank would give you a finance to go and empower other people. So more than anything else, I'd like to thank all of you for this opportunity, but yeah, there's so much to be done. I'm grateful for this opportunity. I can say much, but it's only 2 minutes. So thank you, leaders. Thank you.
Thank you. In that order that announced, can you follow each other so that we manage time? Can you stand on this podium so that anyone, when you stand up from the podium, someone came in like that order because we move with time. Thank you.
Ndoda. Madoda. Madam Speaker, all protocol observed. I'm Reverend Thompson Mvambo from the Moral Regeneration Movement. I want to acknowledge the presence of the convener of the Moral Regeneration Movement in Gauteng, Ufada Tolani Tlwati, and other coordinators who are here. Mine is just a short message. It is to talk about moral, ethical behavior. Our society is challenged, and people who are supposed to be exemplary are actually doing the opposite. Our young boys, when they learn from us, and what we do has an impact on them. And it has an impact on how they think they can model themselves as they grow up. Siyabona lento yokuphanda, it's part of something that has become an accepted culture. But actually, it is the opposite of it. Because when our young men see people driving flashy cars, doing certain things that sometimes are not very positive, they think that is a good way of conducting themselves. And that's why they want shortcuts to life. Our young people, instead of being encouraged to take education serious, they already are thinking about a tender. Now, that's a culture that is very dangerous. We cannot have a society of tenderpreneurs who are not looking at the future positively. But shortly also, let me also address an issue that I know very well that we are concerned about, and it affects us. And it also concerns how some of the religious leaders behave. Religious leaders are supposed to be an exemplary to society, but some of us are such a bad example, such that the church, I'm going to put the church in commas.
Your 2 minutes is up.
Yes, I'm done. The church is becoming a bad example. And I'm asking for all of us to work together to ensure that we protect our society and protect our communities. Thank you very much.
Matota, Ndota. Greetings, Chair. Greetings to all leaders that are within us today. I think I want to start with just a reflection of last week. I think about a week ago, it was Friday, if I'm correct, Friday last week, I heard for the first time that it was International Day of the Boy Child. But what hurt me the most when I heard that is that there was nothing done for the boy child. I think most of us here didn't even know that last week, Friday, was International Day of the Boy Child. This brings me to ask a question: what are we doing about the young boys? My name is Zipo from Father a Nation. We go around doing talks to young boys and men about positive masculinity. And when I ask young boys at high school, do you guys have mentors? 70–80% of them tell me they don't have mentors. My biggest problem with men these days is that we don't know what role to play. We don't know what role to play in society. We don't know what role to play even in our own household. For any society to die, it's for good men to be quiet when bad things happen. It's not that we have an influx of bad men. It's not that we have a lot of bad men. But we have a lot of good men that are quiet when bad things happen. Gender-based violence, child abuse, crime, it will continue rising if men are quiet. Any society that that has men that don't play their part, it will die. If we are complaining now of things that are happening here in South Africa, they will get worse if us as men don't gather like this and find solution. Even our health as men, we don't focus even on our own health. One thing I'd just like to raise before I step down is we have a lot of men that are unemployed. Unemployment is not the only problem. The problem becomes with the men. What role do they play now in their household when they cannot provide financially? We need to sit down. I think we need to sit down as men and have these honest conversations and stop moving around and blaming. We live in a society where a lot of men are just saying, it's women that love money. From doing my work, I'll tell you now, also there's this saying that women love a man with money. From doing my work and going around in communities, I'll tell you now, also men love men with money. They even have names for them. Elikhua, Engamla. An old man stands up for a younger man just because he has money. So we need to have these honest conversations. I think one of our speakers earlier on asked a very critical question. of what is a man. We all need to dig deep and ask ourselves this question: what is a man? One of the answers will be a man is a provider. But the question is, if you can't provide financially, what are you providing as a man? So we need to have these honest conversations.
Your 2 minutes is up.
Chair, sorry for taking more. But with those words, I'd like to say thank you very much. We have a lot of work in front of us, but it will need us to be strong. It will need us to dig deep. One of the speakers said, you are a brand. I always say, treat yourself as a celebrity. People are watching you. How you treat yourself, there's someone looking up to you and wants to be exactly like you. So you are already a role model to someone else. You might not know it. So how we treat ourselves, but impart that to others also. Thank you very much.
Thank you very much. Can we rise up for the Contralesa representative to come to the podium? We may be seated.
Ndizawubulisa. Ndithi xa ndibulisa ndithi njeza. Injeza ke indoda. Abasuka nam kulaa ndawo ndisuka kuyo abandazi. Xa ndithi njeza ndithi indoda. Njeza. Xhosa. Ndithanda ukubulela lithuba lingaka. Indlu ke ndisuka kuyo i-Kingdom kaMashiya, but ke mna ndimele oshwabada oXaba onomjoli under i-crawl kaXaba. Ndiyayithanda le nto yenzekayo amanjeza xa idibene olu hlobo. Into ebalulekileyo masinganiki abantu abangazaziyo izinto. Niyandiva siswa? Masinganiki abantu abangazaziyo izinto. Njani? Unika umntwana akazi isibongo sakhe. Uzoyiphatha kanjani le nto umnika yona engazazi? So ke ndithi ke silapha singamadoda ase Region G. We've started a campaign apho sifundisa khona umntwana ngezithakazelo zakhe azazi. Nasezicaweni siyangena uba babhiza abantu bakhonza kodwa bazazi uba basukaphi. So ke ndlu ubambano lubalekile ndlu emnyama kuba thina kuthiwa singabantu abathe thu eludakeni. Ngako kuthiwa simdaka, hayi ngoba singcolile kodwa kuba sirepresenta ntoni umhlaba lo siubangayo. So ke manjeza ndizowuhla kodwa ke andihli ndonele ncam kuba isikhalo sethu singamadoda imisebenzi. Awungeke ube indoda ungaprovide. Kufuneka uba uthi uprovider uprovidele umndeni wakho. So ilizwi olibekayo liye lingavakali kuba kaloku awunanto uyibekayo etafuleni. So ke ndlu nibheke futhi kukho enye into ehambayo ephembelelisa i-gender based violence. Siyathandana, sinikeziwe uba sithandane, kodwa wena ujikele ngaphaya unyusele oluthando ndinalo for wena. Xa sawundishiya ke ngoku ndithini? Ndiyakubulala lo. Ndiyakubulala ngela yeza lika Espy lisaqhuba apha kum lisathi usandithanda na. Wena sowudikiwe ndimi. So naleyo iyafuna ama-traditional healers akayijonge kuba anika i-love portion. That love portion ayina expiring date. Ungathi uphuma nayo ngoku pha ibe expired. So ke ndibulele Manjeza, ndibulele ithuba kunkululeko lo kaMadikizela koXaba. uXaba noMadikizela into enye. Khosi. Xa ndithi Khosi ubuhlanti buya omama bayalelizela. UXhosi ngwimbali yethu yakudala eyavalwa ngomabonakude babulala izalukazi kwakuthi xa kuhlwa ilanga isalukazi sibeke abazukulu ngapha sibachubele ngokoyika babesoyikisa besifundisa besakha kungako singasoyiki into kuba kaloku sesibhekele omabonakude uyithembe la container leyo ba izokhulisa umntwana wakho uzumvalele xa sexakile ubuze kuthi Khosi Mandela.
Thank you very much. Can we rise again for Hosihadi Wabahlokwa to come to the podium? You may be seated.
Thank you so much. Monna. Indoda. I'm trying to get into the track of the slogan. My apology if I'm not doing it correctly. Ke rata ho dumedisa Madam Speaker, the Office of the Mayor, and all the esteemed leaders and traditional leaders and everyone who's here. Ka lebitso ke Mosibudi, Deborah Ramokobala from the Batlokwa clan, hailing from Batlokwa, Balimpopo, under the Batlokwa Machaka. I'm really humbled that I'm here today, and I'm so happy that some of the elements that we are dealing with in terms of leadership development, they were touched. Though I'll just speak on two things, and also my sincere apology, Madam Speaker, to complain on behalf of others. I think the duration of this conference is too small for the issues that needs to be unpacked within the men's sector. I really pray that next time, let the duration be on a higher level. I'm sorry. There's a speaker who spoke about the circumcision, and he spoke that the traditional circumcision are being vetted, but there was 2 weeks back where we were talking about the outcomes of the traditional circumcision. When these young boys are coming out of the mountain, they are unruly. And as men, you need to be accountable and responsible for that, especially the traditional leaders and the traditional healers. We are dealing with young men who think that they have grown up after coming out of circumcision. So I pray that all leaders that are here who are dealing with that aspect, you go deeper in terms of developing the mindset of these young people when they are in the mountain. I'm gonna talk about also, I think I'm just touching as well because the time is too small. Some of the speakers spoke about the HIV. As a man, you need to be responsible for the sperm that you are inserting inside us. Because without this, The sperm is the one that recreate. The sperm comes with so many things in it. It either produces a child, and that child might produce a nation, or the child might become useless in the street, or it will produce the STDs and the HIVs. But many of you are not really accountable of the spread that is going on in the nation. And I pray, as a part of the message of support coming from Batloka, to say, look at yourself as man. Umang monna. My slogan today ke hore, monna buela madulong ahau. You need to go back to the way that God created you. You were born, you were created before woman, and your purpose was to recreate. Yes, we are having wombs where you are inserting your sperm inside, but it is your responsibility to know that the seed that came from that sperm, I'm now talking about the men who are just accountable and responsible for only the children that are within their current marriages and their current relationship, neglecting the children that have been born through that very same sperm. These days, men are just accountable for the children under their roof. But what about the one that is roaming in the street, irrationally so? Because that child is saying, my father, the sperm that created me, has neglected me. It is your accountability to go back to the seeds on the street that are roaming under the substance abuse.
Your 2 minutes is up.
Thank you so much. Thank you so much. I just, as I said, I think the duration is just too small, but please think about it and act.
Thank you very much. Can we move to the representative from Sanka, and followed by the Kram Region E representative, Chris Mabunda, and then from there, the GAC Men's Sector Secretary to give the message of support. On that order, thank you. And all those people come closer so that when the Sanka finish, the other speaker get in so that we manage our time. Thank you.
Madota. Good morning, everyone. My name is Pio Kumalo from Sanka, Alexander. I would like to take this opportunity to speak today. As a social worker, working at Sanka, I've seen firsthand how deeply our community are affected by substance abuse, poverty, violence, broken relationships. But I have also seen the power of transformation, especially when the men and boys begin to take accountability for their actions, their choices and their role in our societies. Accountability is not just about taking responsibility after something has gone wrong. It's about actively shaping the kind of fathers, brothers, partners, and leaders we want to be. And before harm is done, it means changing the harms, norms, showing strength through vulnerability, and being brave enough to seek help when needed. Substance abuse often becomes symptoms of deeper pain that men are told to bury instead of heal. But when men are equipped with the tools, express emotions, to stand up against gender-based violence, to raise their child with love and respect, and contribute meaningfully to community, that's when true change begins. As Sanka, we believe in prevention, education, and recovery, but also we believe in partnership. Today, I ask each of us, right, to stand alongside and partner so that we can take out accountability and change our societies. Thank you.
Thank you.
Madota. Madota. Viva men sector, viva. Viva COJ, viva. Madota. Sanbonan. Niyaphila. Nami ngiyaphila igama uPrince unsikelelo wakwaSoga uSecretary lona weGauteng Men's Sector. We are here Nathi to give a support and a recognition to the great work that is done by Men's Sector in the district yase Johannesburg. We want to congratulate you, gentlemen, for the wonderful work that you have done in putting together such a beautiful event and activity, which I believe it is going to leave a mark in the heart of every man or corner la. We must all remember ukuthi as men we are seed carriers, not only carrying seed that is a sperm, but we are carrying seeds that we can be able to plant in other men wherever we are found. Emsebenzini la sebenza khona kwema families wethu eyitoro lapha emakhoneni la sibloma khona ngizwile omunye la ukhulume ngokuthi lapha emadayizini la sidlala khona. We can carry this message esuka from this gathering and say we have got a challenge, or we have got a responsibility as men in Gauteng, as men in Johannesburg and the other districts, to say, let us put efforts together and become better men for tomorrow. As a province, ladies and gentlemen, sanibonani bomama, we have got a mandate from the National Office here, Men's Sector, to say, let us run a campaign, yeah, Better Men for Tomorrow. Better Men for Tomorrow is aimed at contributing in the Close the Gap campaign by the National Department of Health, to say, let us trace, find out the Madodalawa that know their status but are not on treatment and bring them back to treatment. But it is in such gatherings where we can say, if you have not yet tested, please make sure that you test, you know your status, and if you know your status and you are not on treatment, we ask you to go back and take your treatment so that we fight the scourge, say HIV. Thank you so much. Madoda.
Madoda. Ndoda. Ngiyabonga. Madam Speaker, the Chairperson, Mr. Charles Pepu, and then ngibonga futhi ne office la ku mayor nalaba buya e province namakhosi wethu akhona namhlanje. I think nivumelana nani ukuthi isikhathi isincane for ukukhuluma ngale issue lena yamadoda nabafana namajaha. Kufanele sikwazi ukuhlukanisa ingane nomfana nejaha nendoda. Ufanele udlula kuwonke lama process akhona ukuthi uze ube indoda. Sibone ama stats ukuthi yakhuphuka kakhulu, but ke ngicabanga ukuthi eze sinama regions I7 wonke lama regions ivangeli fanele ifikelele. Mangibhekile eregion asishayeleni ihlombe bafethu ngoba yine something eyenzayo Mina ngila Chris Mabunda from Ikram Men's Forum. Sibheke kakhulu amadoda asebenza eCity, especially Johannesburg region E. Ama challenges abanawo again nokuthi makuba nama awareness campaign especially health. Siyabakhuthaza ukuthi bakwazi ukuthi baye boyocheka. Namanje nje ngibe ngithi maybe mhlambe Madam Speaker nama councillors akhona bakwazi kuyibheka lento lena. Nesasa kufanele sicheke uthi mhlambe mawungasebenzi noma usebenza mawuyothola isasa at least isuka ujikile ku health department bakuchekile yabo ukuthi at least ukwazile ukucheka ukuthi awunakho lokuya ugula nayo khona uzothola le 370 then mawungachekanga akwazi ukuthi uyithole sibe sizogaina something ukuthi abantu bangakwazi ukuthi bahlale emakhoneni ngoba le 370 lena bayayifuna bohlala ngayo ezinamhlanje kuyi Friday bohlala ngayo lapha ePotweni. So asenzeni sure ukuthi nalena bayenze sure ukuthi bandlule esibhedlele eclinic. Namhlanje ngibengicabanga ukuthi nala ngaphandle la bozowa khona ba health abachekayo wonke umuntu olana ukuthi at least mawuyofika ekhaya uyazi ukuthi wena isitezi sakho sithini. So ngajabula kakhulu ukuthi maybe mhlambe mabanga bakhona la bacheke kancane lapho singajabula kakhulu Bab Charles no Madam Speaker even namanye ama stakeholders nina nikwazi ukuthi amadoda babe khona amadoda bangasabi abo mama yibo ba lead imizi yethu because thina amadoda sibuyele emuva and if abantwana bathi lapha kumama Karabo siya kumama uphindile kanti umuzi wakho awaziwa wena waziwa nje ngento elumayo mawufika ingane ziyakubaleka. So asiyeke lapha sibe closer nabantwana bethu esizokwazi ukuthi sibafundise. Mina ke nguChris Mabunda ngwana Mexoni wamahatlani wahosingobe wahosinkulunyabane Mabunda nithi mhlabe Mabunda ngiyabonga.
Thank you very much. Now I'm going to explain what's going to happen after some few speakers. We'll go to the commission. I heard a lot of people, they say 2 minutes is not enough. Today we are not here for speeches. We're going to have commission with men to talk, and then commission 1 will be at this door, at this outside there's a table, and commission 2 at the other table. You jump 1 table, commission 2 will be there. Commission 3 will be this side, and commission 4, which means the first table, and then the commission 4, the last table. Similar to this side, the first table and the last table. We're going to group in the group of 20, 20. Apology for Bomama Bakona. This discussion, they can't be allowed to be part of it, but they will have the feedback because we're going to give feedback here at the chamber. Because today is a men's parliament, but we acknowledge their present. Thank you very much. I would like to take this back to council, to the speaker, so that we will handle the other program. For so doing, because ngibona ngathi abantu bayalala singacela ingoma eyi-1, then after that ngoma council will take her over and continue with the speaker will take over and continue with the next aspect. Ingoma madoda.
Izolo mthanda bam. Zumpe tagaba.
Thank you very much. Thank you, no, da. Thank you, time, please. Sorry, time, please. Time, please. Otherwise, I can call Sergeant in arms. We are at the parliament, we work with time. So thank you very much. I would like to to hand over back to our speaker because we have people who are left without joining us. They arrive here, and then I will hand over back to speaker. Thank you.
Thank you, Co-Chairperson. We'll continue with our reports. The City of Joburg Men's Sector Chairperson report will be presented by Mr. Bafana Dube, the first Deputy Chairperson of the City of Johannesburg Men's Sector. Mr. Bafana Dube, you can come to the podium.
Matota. Matota.
Thank you, Madam Speaker. The co-chairperson, who's the chair of the men's sector in the City of Johannesburg, members of the mayoral committee present, the councillors, the provincial leadership of the men's sector, the provincial leadership of the Gauteng AIDS Council, Amakos, Bundabezita. I'm here to present the report of the chairperson. Those that know I'm not the chairperson, but because the chairperson is given a responsibility to chair this sitting with the speaker, that's why I'm presenting. I thought in preparing for the presentation, also one need to give a brief background with regards to the establishment of the Men's Parliament. I'm not sure if this can be flagged or what, Chair, or it's fine.
Do you have a presentation?
Yes.
Okay, please hold on. IT, please assist.
I can actually PPT. Yes, thank you. It was in 2018 when a pivotal moment was the launch of the Men's Championing Change campaign, and subsequent the Men's Summit held in KwaZulu-Natal in August 2018. The aim was to gather men and youth to discuss plans to eradicate gender-based violence, and then this summit initiated dialogues at provincial levels, and followed by the Boys' Assembly, and then also the first National Men's Parliament in November 2018. The launch of the COJ Men's Parliament was a landmark moment, a commitment by men, for men, and in partnership with the stakeholders, to actively address the multifaceted issues impacting our communities. We envisioned a platform for dialogue, advocacy, and action where men could collectively control societal ills and contribute meaningfully to positive change. We embarked on this crucial mission in October last year, 2024, in this very same chamber, Konibapela Council Chamber, driven by a profound recognition of the pivotal role men must play in building a safer, healthier, and more equitable society within our vibrant city. So I thought it's important so that maybe some of us are in this parliament, but we don't know where it comes from. Moving on, the period under review has been marked by persistent challenges in combating HIV, TB, and gender-based violence and femicide, which remains intertwined public health and social crisis in Johannesburg and South Africa at large. Despite progress in treatment and prevention, the burden of disease and mortality remains high, exacerbated by systemic barriers and socio-economic factors. One, on issues of HIV. While men account for roughly 1/3 of the new HIV infection, they represent more than half of HIV-related deaths. Recent data from the South African Medical Research Council indicates that HIV-related mortality may be significantly undercounted, with new evidence suggesting that HIV could be responsible for up to 23% of deaths nationally, far higher than previous estimates. South Africa continues to face a substantial HIV epidemic, with men disproportionately affected in terms of AIDS-related deaths. Efforts to scale up treatment have been intensified, with the bold national initiative launched in early 2025. Those that know, it was launched at Baragwanath Chris-Hani Hospital. An additional 1.1 million people in life-saving antiretroviral therapy by the end of the year 2025, which means we've got a responsibility in making sure that these 1.1 million, which majority of them are men, who are 650,000 of the 1.1 million. So officially the campaign is known as Close the Gap. So efforts to scale up treatment have been, have been there. These campaigns is critical to achieving the 2020 goal of ending HIV as a public health threat. However, challenges remain. 650,000 men nationally are not on treatment, including lower viral suppression rates among children under the age of 15 years, which is around 67%, and gaps in viral load testing coverage. On TB, which is also one of the things that we need, and we always have these discussions. I think the second deputy chairperson of the Johannesburg AIDS Council, or the CSF, always emphasizes this thing to say, we need to make sure that TB is also, people are also made aware that there's treatment and people can live. There's no need for people to die. TB remains a leading cause of morbidity and mortality in Johannesburg, closely linked with the HIV epidemic. In 2021, over 172,000 people were diagnosed with TB nationally. Johannesburg rated the third highest after eThekwini and Cape Town. So it means in Johannesburg we have a serious work that we need to do with regards to TB, with a significant proportion having multi-drug resistant TB, which is called MDR. TB accounted for nearly half of deaths among people living with HIV, underscoring the deadly synergy between these diseases. Treatment success rates for drug-sensitive TB have around 78%, but MDR TB outcomes are less favorable at 65%. The ongoing challenges is to improve early diagnosis, treatment adherence, and integration of TB and HIV services to reduce TB-related deaths. In 2021, 304,000 people in South Africa contracted TB and 56,000 died as a result of this preventable disease. On gender-based violence, gender-based violence and femicide remains a pervasive crisis, deeply impacting women and girls who also bear the brunt of the HIV epidemic, with 62% of new infections occurring in this group in 2023. The city of Johannesburg has seen continued reports of gender-based violence cases, with significant delays in finalizing investigations and providing psychosocial support for survivors, as noted in cases from late 2024. Innovative projects such as the Panic Button Initiative are being deployed in GBV endemic areas to improve case finding and survivor support. Yet, systemic challenges persist, including disruptions caused by funding freezes affecting trauma and post-exposure prophylaxis services. One of the things that I've realized is that as the city of Johannesburg, we do not have a data of people, of gender-based violence cases. So I think it's one of the things that as a city we need to take serious and improve on it so that when we speak on these issues, we speak on something that we all understand and know. While exact local figures for Johannesburg are pending final compilation, national trends indicate that HIV-related deaths remain a leading cause of mortality. The South African Medical Research Council study suggests that HIV deaths are underreported by up to 4 times compared to official statistics, implying a higher death toll than previously recognized. Nationally, HIV deaths declined from over 67,000 in 2022 to approximately 51,000 in recent years. But men continue to experience higher mortality rates. TB-related deaths remain high, particularly among HIV-positive individuals, with TB causing 46% of deaths in people with HIV. The core epidemic of TB and HIV accounts for nearly 30% of all deaths in South Africa, reflecting the urgent need for integrated interventions. In gender-based violence deaths, although less quantified, contribute significantly to mortality and morbidity in Johannesburg. Delays in investigations and support services exacerbate the trauma and risk of survivors, with ongoing efforts to strengthen response mechanism. Now, the strategic response and way forward. As the City of Johannesburg Men's Parliament, to acknowledge the critical need for enhanced HIV testing, treatment and viral suppression programs, especially targeting men and children, to close the gaps in the HIV treatment cascade. Integrated TB HIV services to improve diagnosis, treatment adherence, and reduce mortality from co-infections. Strengthen gender-based violence prevention and survivor support system, including timely psychosocial services and legal interventions supported by technological innovations and adequate funding. Community engagements and male involvement in health promotion and gender-based violence prevention, recognizing men's pivotal role in reducing
Siyabonga, Mr. Matipa. The last speaker before we break into commission to do the introduction of regional men's.
And I need actions, the leadership, so that we know if we are dissatisfied with the district, we call people by their names and we find a by Bafana Dube, who's the deputy chairperson of the city.
Madota.
And then lastly, I would like to introduce Uneo Matipa, who's the deputy secretary. Ngiyabonga, that's the role I was given for now, but.
Now I'm going to discuss about our issues. What are the topics? And because time is not our side, and remember all of those people who are here, the speakers, Fana to tell us what to do. Thank you.
Madota. My knowledge, the leader, we are led. Comrade Tsepo Lekwape, my leader, my apologies. Commission 1 and 2 will sit this side. There's a first table that will be Commission 1. You skip one table this side. Outside, there are tables outside. The way I said it on Commission 1 and 2, there's mental health. I'm hoping we're writing down. I will request that of the regions in the men's sector in terms of scribing, so that when we come back we do present. Okay, the first one is the root cause of gender-based violence for male survivors of gender-based violence. It's, did we say mental health?